Hello everyone, welcome back to our channel. In our today's video, I'm going to provide you expert tips about OET writing to make your letters look clear and professional. So we will be looking about its structure, vocabulary, clarity and tone. Now, let's start with one of the most important things in writing, structure. Think about it like building a house. You need a solid foundation, walls, and roof to make it strong. Similarly, your letter needs a clear, logical structure to stand tall. Imagine you're a nurse and you have a patient named Emma who has just been diagnosed with type 2 diabetes. You need to refer her to a dietitian. So here's the structure that you should follow. Start by addressing the right person in a professional way. Example here, dear Mr. Johnson. Okay, and then introduce the patient and the reason for the letter. Try to be concise but clear. Here is an example. I'm writing to refer Miss Emma Roberts, a 52-year-old female patient for dietary counseling following her recent diagnosis of type 2 diabetes. And later comes the body of the letter, so which includes the medical details. This is the place where you shine. Try to provide all the necessary details like the symptoms, test results, history, and medications. Ms. Roberts has a history of hypertension and obesity. Her recent HbA1c level was 8.2%, indicating poor glycemic control. She has been prescribed metformin 500 mg twice daily. And then request. Try to ask for assessment or further recommendation. I would appreciate your assessment and any dietary recommendations to help manage her condition. And finally, wrap it up nicely and thank the person for their time. Thank you for your attention to this referral. Please do not hesitate to contact me should you require further information. And kind regards, Nurse Jane Smith. This is how an appropriate letter looks like. So it should start with a greeting and then the introduction, then the body with the supporting details starts from the history, symptoms, medications, or if any test results available, or further suggestions or assessments required, and what you expect the other person to do. And finally, you should end with a closing note. Got it? Now, let's move on to the next important thing which will make your letter stand out. That one is medical vocabulary. So, this is your chance to show that you know what you're talking about, but don't go overboard. Remember, accuracy and clarity are key. Imagine you are writing a discharge letter for a patient who has been hospitalized for a stroke. Instead of using simple terms, try to spice things up a little with advanced vocabulary, but in a way that is still understandable. Remember that. So, here is a basic example like the patient had a stroke and is doing better now. They need to take some medicine and rest. And here is an enhanced version. Okay, I'll show you that. Mr. John Davis, a 68-year-old male, was admitted following an ischemic cerebrovascular accident. He has shown significant improvement and is now stable. He is prescribed clopidogrel 75 mg daily and advised to follow up in 2 weeks. See, how does it look? This one sounds much more professional and detailed, right? Because words like ischemic cerebrovascular accident and then clopidogrel and follow up, right? These words make the letter sound more informed and trustworthy. So, this is the kind of language that you need to use in your OET writing. It shows that you can effectively communicate medical details with precision. Now, let's talk about one of the biggest killers of any OET letter, ambiguity. No one likes unclear writing, especially healthcare professionals who are reading your letter. Here is an ambiguous letter. The patient has been having some issues and was given some treatment. Please see the patient soon. What is this? Confusing, right? It's unclear what kind of issues were present that was not mentioned, what treatment was given not mentioned, and what does the word soon means. You need to be specific, right? Now, let's fix that and make it clear. So here is a clear and a proper example. Ms. Linda Green, a 75-year-old female, presented with acute shortness of breath and was diagnosed with congestive heart failure. She was treated with intravenous furosemide and has shown improvement. I'm referring her for a follow-up echocardiogram and cardiology consultation. Did you find out the difference? See how this one, the second example, clearly outlines the symptoms, the diagnosis, treatment, and the next steps. So, specificity makes your letter not only clearer but also more actionable. So, try to be more specific when you're writing the letter. The next one is tone and formality. In healthcare, it's very essential to maintain a professional tone in all communication, even when you're writing a referral letter. Tone means the way you express yourself, and formality means it refers to how polite and respectful your language is. Let's say you are writing to a colleague about a non urgent issue. So here is an informal tone, okay? Hey, Dr. Sarah, I'm sending you those patient details for a follow up. Could you see them sometime soon? So this one is not idle. We are dealing with professional healthcare, so we need a polite and formal tone. Here is how we could rephrase it. Dear Dr. Sarah, I'm writing to refer Miss Angela Williams for a follow up consultation regarding her ongoing treatment for type 2 diabetes. I would greatly appreciate it if you could see her at your earliest convenience. Please do let me know if you need any further information. Sounds perfect, right? So always keep your audience in mind and match the level of formality to the situation. Remember, the tone is just as important as the information because it helps you sound competent and trustworthy. All right. Now that you have a good understanding of how to structure your letter, use precise vocabulary, maintain clarity, and keep the tone professional, you are well on your way to acing your writing task. And remember, practice makes perfect. Keep refining these skills and applying them to different scenarios. I want you to try this now. Think of a health related situation, whether it's a referral, discharge, or clinical case, and try to write a short letter. Be sure to follow the tips we covered today. Okay? That's all for today's OET writing tips. If you enjoyed the video, don't forget to like, subscribe, and hit that notification bell so you don't miss any of our upcoming OET preparation content. Keep practicing, stay confident, and you'll be on your way to a fantastic score. Until next time, good luck and take care. Bye bye.